Okay, so finally to content. When we talk about advocacy, there's a couple different types of advocacy that we all do, right? There's personal advocacy where somebody calls us up and they say, I need help. My son's in this situation, da 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 da. And we help try to figure out resources, ideas, suggestions for that person. We help to advocate for everything around a specific person to get them the care that they need, right? But there's also system advocacy, and that's about voicing the need for broad policy changes in your community, state, or country, right? So today is really focused on system advocacy. And we think that there is a successful formula for successful advocacy. If you can figure out the fine art of telling your story for impact in a brief way, connecting that to a pertinent piece of data or research that backs up your position, and making a specific ask, you will find that you can be very successful. And this is going to be a repeated theme today as you go through these different trainings. So, that first story part, it really helps if you can learn to narrow down and focus in on one or two key points that relate to the specific thing that you are advocating for. Okay. It doesn't help to go into a legislator and try to give them the whole timeline of what's gone on with your loved one and all the, bumps and the roller coaster, right? It doesn't help to be that extensive with the history. You have to try to figure that out. And it really helps on this portion if you can practice it because it's emotional talking about our stories. It's easy to break down into tears, but practicing it and getting used to saying the words really helps with that so that you can be effective and not get too teary when you're trying to provide this type of information to legislators. People connect with stories, and that's what moves the heart. But what moves the brain for legislators is sharing the data that backs up your point. If you can show that something is going to be saving lives or saving money or improving public safety, that really helps to get some bills passed. But you really want to target that information, right? If you are talking to a legislator that you know is all about economic responsibility, you want to hone in on making the point about saving money, right? If you're talking to a legislator that is a social worker that's been in mental health care her whole career, you're going to want to hone in about how it's going to limit the suffering of the people that we're trying to help and save lives, right? So you figure out some information and target your message on that. And the third piece is making an ask. It doesn't help if you go up to a legislator the first time you're meeting them and tell them your story and say, I need you to fix the mental health care system. Because believe me, they all want to, but most of them probably have no idea where to even start. So if you're able to be in a position to go ahead and champion a very specific bill and have a very limited ask, it's a lot more effective and helpful. And legislators will be grateful for you that you have a solution to present. And you all in Colorado are so fortunate in having Judy as one of the senators who's very involved in legislation. And she's going to be spoon feeding you that information later on today, which is really helpful. All right. So, what is SMI? You hear me saying that word. We say the words severe mental illness and serious mental illness kind of interchangeably. But at the Treatment Advocacy Center, and while I'm not wearing my TAC hat today, I'm still going to give you this messaging. At TAC, we focus in on the population with the most severe mental illnesses who are most at risk. So, people with schizophrenia, severe bipolar disorder, major depression with psychosis, and not the ones who are currently stabilized and doing well. We care about them and we care about everybody with a mental illness. But we really focus our work around the people with the most severe illnesses who have the highest risks of criminalization, victimization, homelessness, suicide, and death because they have a lack of insight. They have anosognosia. They don't know they're sick, so they can't voluntarily agree to treatment. This is the patient population we really focus in on.